5 uses of regenerative medicine in sports and fitness. In sport and fitness training, there is always that likelihood of sustaining injuries and developing pain. Some of the injuries can heal through conventional and surgical treatments like physical therapy, proper nutrition, and rest. However, if your injury can't heal through such treatments, your doctor may prescribe regenerative medicine. What is regenerative medicine? Naturally, your body triggers a repair to the moment you get an injury. This involves body components like cytokines, growth factors, proteins, and collagen. But if you have high stress levels, your diet isn't well balanced, or your lifestyle isn't healthy, the natural healing process may not proceed to completion. Regenerative medicine applies as a condensed form of healing components to the injured area to stimulate natural healing. Thus, it is effective in repairing and replacing impaired tendons, cartilage, and ligament tissues. The different forms of regenerative medicine. Regenerative medicine treatments can be carried out in four main ways, namely stem cell injections. Depending on the environment, stem cells can remodel themselves to carry out a particular task. For example, when you place stem cells around damaged triceps tendons, they can transform into healthy triceps tendons. Alternatively, they can regenerative medicine specialists typically collect stem cells from your blood, fat, and bone marrow. Alternatively, they can purchase stem cells harvested from placenta tissue or amniotic fluid. These are then injected around your injury to promote natural healing. Platelet-rich plasma injections. Plasma is the fluid of blood. It makes about 55% of blood. Platelets are the smallest fragments in the blood. They help with the clotting of the blood around damaged blood vessels and also promote healing and repair of damaged tissues. To obtain platelet-rich plasma, your physical physician takes blood from your body and processes it using a centrifuge. Gravity helps to form a layer with a high concentration of plasma and platelets. This is harvested and injected into your injury. The influx of platelets stimulates faster healing. Cartilage regeneration surgery. Damaged cartilage may not heal fast because of the blood supply to cartilage isn't sufficient. Therefore, your doctor can transplant cartilage from one part of your body to another. You can also get cartilage from fellow human donor or animal. Another alternative is to implant engineered tissue developed from stem cells. Prolotherapy. When you get an injury, it's inflammation that triggers the flow of blood and its healing process, such as monocytes, granulocytes, fibroblasts, and macrophages into the injured area. However, if inflammation stops prematurely, the injury may not completely heal. That's the basis of prolotherapy, which involves the injection of an irritant into the injured area to increase inflammation. This promotes more complete healing. Application of regenerative medicine. With the above background, you can better understand the uses of regenerative medicine in sports and fitness. Read below for details. Number 1. Enhanced healing of injuries. By engaging in sports or fitness training, you can get quite a number of injuries. These include the following: sprains and strains. As you go about athletic maneuvers, you can tear or stretch any ligament in your body, especially those in your legs and arms. A ligament typically connects bones at a joint. Such injuries can also occur to a tendon, which is the fibrous tissue that join muscles to bones. In this case, it's referred to as a strain. Common symptoms of sprains and strains include pain, weakness, swelling or bruising around the ankle, knee, foot, leg, wrist, thumb or back. Inability to use these body parts as you normally would, limited flexibility, and muscles painfully tightening on their own, otherwise known as muscle cramps. If conventional treatments like ice therapy, heat therapy, resting, massage, and acupuncture don't work, consider seeking regenerative medicine treatment. Tennis and golfer's elbow. If you overuse your elbow or fail to stretch it enough, the likelihood of your extensor tendons to get inflamed, the resulting pain may make it difficult to handle any activity that involves the use of outer elbow. This is referred to as tennis elbow. If the injury if the injury is to the inner side of your elbow, the condition is called golfer's elbow. The two injuries can be treated using regenerative medicine. Knee injuries: you bend your knee thousands of times whenever you're playing a game. Each bend engages delicate bones, muscles, tendons, and cartilage. As such, you can experience injuries like fractures, anterior cruciate ligament tears, jumped knee, and dislocation, among many others. This can be painful at the point you find it difficult to stand up and walk, and thus unable to participate in sport activities. Regenerative medicine may help you heal faster and continue enjoying your favorite sports. Bursitis. Your joints have fluid-filled sacs that cushion the bones, muscles, and tendons. These are technically known as bursae. When they get inflamed, you develop the condition called bursitis. This commonly affects your shoulders, elbows, knees, heels, and hips. While bursitis pains can subside with a few weeks of rest, persistent symptoms may be treated by regenerative medicine. Lacerations and abrasions. In case the field you are playing on has sharp objects, you risk having shallow or deep cuts on your skin. The minute this happens, you should stop the bleeding by applying pressure on the area. Then wash the wound with warm water and soap. Apply an appropriate antibiotic on the area and seal with a bandage. You should also consult your health provider, especially if the cut is deep or you have not had a tetanus shot for the past 5 years. If for some reason the wound fails to heal or becomes excessively painful, you may want to try regenerative medicine. Fractures and dislocations. A fracture refers to a broken bone. This can be anything from a small crack to a complete break. On the other hand, dislocation is the slipping of a bone from its natural position into a joint. Fractures and dislocation occur when a bone is impacted by a relatively strong force. For example, for footballers, an opponent may miss the ball and forcefully strike your leg. Treatment usually involves placing the bone pieces back into the natural position and stabilizing them with a cast until they heal. While this treatment works, your physician may recommend regenerative medicine to hasten the process. Number 2, alleviation of acute and chronic pain. Acute pain is that which lasts up to 3 months. Beyond this period of time, the pain is classified as chronic. Normally, pain goes away when an injury heals. However, chronic pain can continue for many years even after the healing of the injured area. With such pain, you find it difficult to play that game you like or exercise for fitness purposes. Some treated options for chronic pain include massage therapy, self-help, yoga and meditation, stretching and strengthening, heat therapy, ice therapy, use of CBT pain relievers, transcutaneous electrical nerve stimulation, taking over-counter painkillers such as aspirin, naproxen, acetaminophen, and ibuprofen, changing diet and lifestyle surgery. Take note that regenerative medicine treatment is also part of this list. It promotes faster healing of the painful area and reduces inflammation. This helps reduce chronic pain. Number 3, improved function of organs and tissues. With regenerative medicine, it's not just a matter of healing injuries and tissues and organs. Since it involves the reproduction of new cells, the damaged tissues and organs may emerge stronger and more functional than they used to be. It's like building a new organ altogether. That's what sets apart the treatment option from the crowd. Say you are a basketballer, but your injured ankles and knees can't allow you to jump high or make lightning quick sprints. After undergoing regeneration, your ankles and knees can get strengthened enough to make you jump higher than you used to or run faster than your original pace. Number 4, reducing the risk of future injuries. In the line with the thought above, regeneration develops stronger ligaments, tendons, bones, and the like, and thus reduces the risk of injury. It's obvious that weaker tissues and muscles are more prone to get injured compared to stronger ones. As experts claim, every athlete has their own weakness. Suppose yours is the ankle of your right leg. No matter how careful you get in the sports field, you end up injuring this ankle time after time. To avoid recurrence of this injury in the future, you can take advantage of regenerative medicine. Number 5, organ transplant. As a sport and fitness enthusiast, you are not immune to conditions that may necessitate the replacements of your organs and tissues. Some of the commonly transplanted organs include heart, kidney, liver, pancreas, lung. You may also require replacement of tissues such as tendons, veins, cartilage, skin, bones, heart valves, corneal tissue. Most of these come from fellow humans whose blood groups are compatible with yours. Otherwise, tissues such as cartilage can be obtained from animals. Once transplanted, the new organs and tissues need to seamlessly bond with the rest of your system to ensure proper functionality. This can be facilitated by regenerative medicine. Alternatively, new tissue can be manufactured by growing cells around scaffolds. This can be used to repair or replace part of the bones, blood vessels, skin, cartilage, bladder, muscles, and such like tissues. How to choose regenerative medicine specialist. Regenerative medicine treatment is very delicate treatment process. For instance, poor storage and transportation of stem cells obtained from amniotic and placenta tissues may result in them dying. In case you are injected with such, you don't expect your injury to heal as expected to, and that tells you need to choose regenerative medicine specialists that know how to do their work. Here are some factors to consider when looking for one. Qualification. Does the physician in question have the relevant training to handle tissue regeneration? Ask them to show you their certification. Don't settle for a self-taught individual. Professional training and certification imparts some level of knowledge that can't be obtained by perhaps searching for information online. Experience. Aside from training, has the doctor treated injuries using regenerative medicine? Did the patients heal or they got worse? Look into such tissues to avoid appointments. If the treatment didn't work for others, you may not be very confident that they'll work for you. Treatment type. As mentioned above in the beginning of this article, regenerative medicine treatment can be done through the use of stem cells, platelet-rich plasma, prolotherapy, or surgery. You need to know what type of treatment a particular physician offers. Not every doctor offers these. Also, not all of these options may be viable for your specific condition. Treatment procedure. Inquire whether the procedure involves the use of anesthetics and other additives. General anesthesia puts you to a sleep-like condition so that you don't feel pain as surgery goes on. This may be accompanied by side effects like post-operative cognitive dysfunctions and breathing problems. Local anesthesia numbs only part of your body, usually the area undergoing surgery. While anesthesia is generally safe, conditions like high blood pressure, diabetes, obstructive sleep apnea, seizures, smoking, and alcohol addiction, and use of certain medication can increase your risk of complication. Therefore, if you have any of these conditions, it's your best interest to avoid regenerative treatment that involves the use of anesthetics. Equipment usage. Will your doctor be using tools like ultrasound and fluoroscopy to guide the injections? It's good to have these details. If you don't want, if so, you want to ensure that they have additional certification for the use of these tools. Non-professional use of ultrasound equipment can lead to damage of tissues as body temperature increases beyond maximum threshold. To conclude, regenerative medicine is very helpful for sports injuries that can't be fully treated using traditional methods like ice therapy, massage therapy, acupuncture, and the like. If done properly, it may lead to complete healing of tissues and organs, and even make up the organs and tissues stronger and more functional than they originally were. Just make sure to work with professionally trained and certified physicians who have vast experience in using this treatment method.